You're a builder by trade, aren't you?
Yeah. But I was furloughed at the time, and I got all these plans to do my bathroom up, so I'd started tiling my bathroom, and I put 2 tiles on and was feeling breathless, and the next 2 tiles, it was like, how can I say, laying bricks that you couldn't lift up. It was that tiring, and I just give it up. Just shouted to the wife, give it up, cleaned up, got into bed, because and it was early morning really, and I never got out of bed again, ever, until I walked to the ambulance. When I came out of hospital, I got no grip. I've just recently got my grip back, so I could only get my hands to there. Walking up the stairs, major, like, if you walk up the stairs, you cough, cough, cough. So it's embarrassing, but to get to the toilet, I use the commode down here, downstairs, and still do. I couldn't hold a kettle, couldn't fill a kettle up, couldn't make a cup of tea, couldn't make a sandwich, couldn't hold anything. Now I'm out little things that you may not notice and you take for granted, like we went on holiday last week and I actually ripped a sauce, tomato ketchup sauce thing. And that's the first time I've done that in like 12 months. So little things like that you notice, because I hadn't got the grip to tear it. Just holding a knife and fork, I couldn't hold a knife and fork. It was like chasing it round the plate. But over time and physio, and it's all come good. I couldn't lift my shoulders up because of being in the prone position for so long when I was in a coma. I couldn't dress myself. Put my socks on, I couldn't put my socks on, I couldn't fasten a belt. And it's a physio and determination get you there. And I had a conversation with the doctor, and to be fair, he wouldn't even treat me because he'd never dealt with anybody with COVID before. And I appreciate that, because he was honest with me rather than guess, because I'd got a really bad cough, and he didn't really know how to treat it. So we had to get in touch with the hospital, the respiratory consultant, to try and get a prognosis on how to treat me. Physio, yes, that started straight from the start, which was brilliant. Home visits, just helping me with walking, just walking around the street. You know, a little walk around from my house to the top of the garden with my oxygen tanks, and just generally building me up as regards walking and looking after me and giving me the confidence to keep going. Again with my hands, over the phone this was exercises with my hands, but it's all helped, as you can see. I've got my hands back now.
So you had hand therapy, is that what that was?
Yeah, hand therapy over the phone. Shoulders, I had one-to-one with Katie Smith. She was Corbett physio, Corbett Hospital. Alison used to come, again, helping around the streets and walking, and yeah, everything was good as regards physio. Couldn't knock them in the slightest. That was excellent. Mine was shoulder movement. I hadn't got any. Physically walking, this hands, and just getting my movement back in general. Because you're thinking better. I thought I was better when I come out, but it's not until you try and get back to normal life that you realise you're nowhere near what you was. You know. Strength-wise, it's, well, I used to carry the shopping in 4 or 5 bags at a time, and now I couldn't pick a bag of shopping up when I come out. It's all hard work. It's hard work to get back. You don't realise what it does to you. You think it's just a lung infection. Far from it. Far from it. And I still struggle with my breathing because I was on oxygen until about a month ago. I've got to the stage where I can breathe normally now, or without it, without the help. But when I come out, I was 24/7 on oxygen while I was asleep, while I was sitting in a chair, and you gradually get your lung capacity back. Down 100%, it's nowhere near 100%. Like so, I had these attacks and they come on in January, February. Never experienced anything like it. I'm cardiology now, under cardiology, heart monitor, waiting for the results on that.
I know you said it's very slow, but when you look back to how bad you were and where you are now, how does that make you feel?
Fortunate. I've seen a lot of scenes that I don't want to see. People being wheeled out with blankets over their heads and knowing that that'd be so fortunate as me. And it scars you. There are many days that goes by that I don't think of it. It's horrible to see. And then them nurses see it every day, or they did. When you leave, they've still got it, haven't they? It's hard to accept that you can survive and others can lose their life. I had a vision of Russell's Hall when they said I was going to Russell's Hall, because I lost my mum and my dad in Russell's Hall, and I don't really like Russell's Hall at all. And I pleaded with the ambulance drivers not to take to Russell Hall. But now I've got the utmost admiration for the place now. I've got everything to thank her for. Like I said, I can't thank them enough, and there was special people doing a special job, and I love them. I love them all. I love them all. They saved my life. That's the best thing they could ever do, Ed. Save your life.